Alrighty, good afternoon and welcome to your 2020-2021 Plan Your Open Enrollment presentation. My name is Janelle and I'll be your presenter today along with Rachel. We did just want to point out that your open enrollment will start in 2 weeks on February the 10th. So we just want to make sure that after you hear this presentation, you keep these things in mind as you're going through your open enrollment experience this plan year.
This is our 18th annual ICUBA Open Enrollment, so we are celebrating 18 years of service to private Florida education institutions and employees. So thank you for being part of ICUBA, and we will continue through the presentation.
Alrighty, so starting off, here is a sneak peek or a preview, if you will, of what we'll be reviewing today. As you can see, we'll be still offering you the same great benefits. You'll still have your best-in-class access to care, your Blue Cross and Blue Shield medical plans, Optum, Aetna, Humana, IMED. We'll also go over some housekeeping, some important things that you'll need to know, and we just wanted to highlight what's new for April 2020. Your low increase on your medical premium, so there was not a large increase this year. We do have some new ICUBA Group AFLAC benefits that we'll be reviewing with you. We have some Rally program enhancements that we'll review. We'll also review again this year dependent verification and how you can enter your phone number and email as you're going through your open enrollment experience. You'll be entered into a sweepstakes for a possibility of winning a great prize.
So starting off with those low medical premium increases, we mentioned during last year's open enrollment presentation that ICUBA is a self-funded medical plan. What this means is that ICUBA pays all claims that are processed by the medical, pharmacy, and behavioral health benefit managers from premiums that are collected from our members. So employees just like you contribute your premiums, they go into a big pool, and all of those dollars that are collected are used for the exclusive benefit for you guys, for premium dollars only for our members. And these plans are designed specifically by educators for educators. So we hope that they meet your needs and help contribute to a long-term culture of well-being so you can be the best version of yourself. So continue what you're doing, and job well done for last year.
Alrighty, so we'll move right into the new ICUBA Group AFLAC benefits that we're offering this year. So we are pleased to partner with AFLAC to offer you your critical illness, hospital indemnity. There's a high and low plan, and also the accident plan through AFLAC. These plans will provide you with better benefits at a lower cost. Right now there's a guaranteed issue, meaning no medical questions will be asked during this open enrollment. And if you had prior individual plans with AFLAC, those will no longer be offered via a payroll deduction. You can port those and pay those directly, and there is some information that will be mailed to you if you'd like to keep those plans that you currently have.
So moving into the first benefit from Group AFLAC, the critical illness plan. This number one question that comes from this is, well, I previously had a cancer plan, or I have a cancer plan through another resource. Well, good news, cancer is included in one of the critical illnesses that are covered by this plan. The coverage includes in this critical illness plan cancer, including invasive, non-invasive, and skin cancer. It also includes heart attack, sudden cardiac arrest, coronary artery bypass, major organ transplant, bone marrow transplant, kidney failure, and stroke. This plan is provided to all eligible employees, regardless of health conditions, current health conditions, and covers the illnesses that are listed above on the screen. This benefit will pay a lump sum cash benefit upon diagnosis. So if you have a heart attack like after your AFLAC plan is effective, you can receive that cash benefit. Each one of these incidents has a varying cash benefit that can be found in the additional information that has been shared with you. All the employees have the opportunity to purchase up to $30,000 at this open enrollment, and then spouses are able to elect half of what the employee elects, up to $15,000. Children do not need to be enrolled in this plan. If they are enrolled in the system, children are automatically covered up until age 26. So the children are by default covered by the employee's coverage. You can take this coverage with you if you change jobs or retire, and if you're not diagnosed with one of these critical illnesses, there is still an annual health screening benefit which would apply. So if you luck out and are one of the people that don't need to cash in on one of these coverages that are included, you still get the benefit of that $50 from getting your annual health test.
Next is the hospital indemnity plan. So this plan covers you if you have a hospital admission or confinement due to an accident or illness. Some of the features of the plan is that it pays a lump sum cash benefit to you. It pays in addition to other insurance coverage, so it does work with the IQBA medical plan. You can take this coverage with you. If you change jobs or if you retire, you can port it. Premiums are deducted via payroll, so there's nothing additional you need to do there. And then no medical questions are asked at this time, so you do get that guaranteed issue. We did want to just point out an example for you on the bottom as far as the payout on the high and low plans are concerned. So if there's admission under the high plan, you're getting that $1,000 lump sum payout. And then under the low plan, it's $500. And then as you can see there, for the confinement for 3 days, you also get the additional benefit under the high or low of the $300. So the total amount paid for you under the high plan would be $1,300. And then under the low plan, that would be $800. We just wanted to give you an example. We know pregnancy is always one of those conditions that are asked about a lot, so we did just want to give you a little example of what you can go on.
The last group Aflac plan that we'll be offering is accidents. Nobody knows when an accident is going to occur, so this insurance coverage can help cover the finances that might come your way if you are involved in something that requires an ambulance ride, emergency room visit, fractures, any bad burns, a concussion, excuse me. And again, if you are one of the lucky ones that does not have an accident this year to cash in on, there is still that annual health screening benefit for $50 which would apply. So there is a wide range of accident-related items that are included in your summary of coverage. And the summary of coverage is linked to the all three of these elections within the benefits portal. So if you want to have more information, I believe your HR department or Emily can provide you with the summaries, and the summaries are also linked in the IQBA benefits portal.
Next, we have the Blue Rewards Powered by Rally program enhancements for the 2020-2021 plan year. We did just want to point out that the Rally survey is still the gatekeeper this year, so you do have to make sure after 4/1 that you complete that survey. We also wanted to highlight the wellness exams are going to be $60 this year. For your biometric screenings, it's $40. And then for those on-campus events, $10 each up to $70. We did increase that number this year. We also just wanted to highlight that your incentive dollars are redeemable for a Rally gift card, so you do have to make sure that you go out to the Blue Cross and Blue Shield My Health Toolkit and get involved in Rally. The coins are still unlimited value, so you are able to earn unlimited coins. I personally use my coins for a lot of the discounts in the marketplace. I find that those are the best bang for your buck as far as your Rally coins are concerned. And then IQBA is still doing the private sweepstakes this year, so you have numerous opportunities to get involved, get engaged in your wellness, and make a few dollars and a few coins along the way.
And just a reminder, if you are earning coins currently, those coins for the 2019-2020 plan year will expire on March 31st, just so we can start a new program on 4/1/2020, and then you will have a brand new bucket of money to begin with on 4/1. So make sure that you go out, and if you haven't already, you'll need to complete that survey for the current year as the gatekeeper, but make sure that you cash in those dollars before the end of March. We're really excited to introduce the physician results form this year. This has been a really common ask at a lot of the meetings that we've had at the monthly meetings that we've had here in Orlando, and a lot of this is a really common ask when we are visiting various institutions. I just got my blood work done at my doctor's office. Can I turn it in for the biometric screening? Well, in the past, that answer has been no, but after April 1st, the answer will be yes. So after April 1st, if you have a meeting with your primary care physician, you will be able to log on to number one, the steps are outlined on the screen, but number one is you'll be able to log on to the Quest portal and print out a physician results form. You'll download that physician's results form, and you will take that with you to your next doctor's appointment where your annual lab work is done. At the annual screening with your doctor, when you complete your annual blood work, your doctor can actually fill out the bottom portion where it says, like, next to number 3 with the red circle. Your doctor will actually complete your information right on the form, and then we ask that you submit the form in 2 ways. Obviously, the physician can fax the form into Quest Diagnostics, but we don't want to leave it totally up to the front desk people at your doctor's office. So we encourage all of you to get a copy of your physician results form and keep it for your own personal information, and also so you can upload a copy or fax it in on your own. Just an extra fail-safe to make sure that you're getting the dollars that you've earned. And again, the biometric screening did increase this year, and you no longer have to get your finger pricked or get your blood drawn. You can now complete this straight through your doctor's office.
Next, we just wanted to go over some rally reminders. We do still have those rally rewards for your chronic conditions. The conditions are outlined here on the screen. So this gives you some additional information and educational materials on your chronic conditions. If you have that chronic condition, it will show up on your Rally site automatically. So we do encourage you to partake in that program. You also will earn 500 Rally coins each quarter for a total of 2,000 coins for the year by participating. And again, we also wanted to draw your attention and remind you of our city challenges and private sweepstakes. IQBA gives away $50 Amazon gift card incentives. For every time you reach a milestone, you're entered. We don't expect you to win those challenges. You just have to participate and make sure that your tracking device is synced with Rally.
So what are the value of these improvements to the new Rally program? I'm sure you guys are all familiar with Emma. She's that little woman in the benefits portal that irritates you each year when she asks you if you want recommendations. Well, we have turned her into our own little cartoon character for this little synopsis. So we want to introduce Emma. And by the next open enrollment, we hope that this will be her story. We hope that Emma would have downloaded the Blue Cross Blue Shield mobile app and located a Blue Distinction Total Care provider. At that Blue Distinction Total Care provider, you know that she will receive all of her treatments for free, all of her visits would be free, and with that free doctor's visit for her annual physical, she will earn that $60 incentive. Through her primary care physician, she can also submit that Quest physician results form, earning her the additional $40 for the biometrics. So just by visiting her annual, doing her annual doctor's appointment with her primary care physician, she's already at $100. At work, Emma participated in 5 on-site events totaling $50, and she's really hoping to squeeze in 2 more. During a recent doctor's appointment, Emma was diagnosed as diabetic. She connected with the Blue Cross Blue Shield health coach, and through the Rally Clinical Reward Program, she has learned to help control her condition. And through that Clinical Rewards Program, she's also racked up quite a bit of coins. To date, Emma this is next year, remind you. To date, Emma has earned $150 in Rally Rewards dollars and has donated 8,000 coins to various rally charities. What I want to call your attention to is Emma, in this example, earned $150 by simply doing what she was probably going to do anyway. She did not receive a mammogram or colonoscopy or any of the items that are really not out of the norm or would not be something that the average person would need to go about. So yay for Emma.
Alrighty, next we want to go over dependent verification as we prepare for open enrollment. Dependents that are not eligible should be removed from the plan during this open enrollment. And if you do remove someone, their coverage will terminate March 31st. So as you're going through your enrollment, just keep in mind that you will have to certify that all the dependents that you're covering are in fact eligible for coverage under the plan. And we just wanted to highlight that.
So who is an eligible dependent? Your legally recognized spouse, a natural child, a legally adopted child, a stepchild, a child that's required to be covered by a qualified medical child support order, a child with proof of legal guardianship who resides with you, and a foster child. Just a reminder, all children are covered up until the end of the year in which they turn 26. So if you have a 26-year-old that has turned 26 since January, congratulations. However, they're allowed to stay on the plan and be enrolled for April 1st coverage, and we will just send you a reminder note in December or as it gets closer to December that they will be removed from the plan as of December 31st.
All right, enrolling in your benefits at icubabenefits.org. Most of you who've been with us know that you go to the iCuba Benefits portal. There'll be a large button there on the screen that says Start Your Enrollment. That portal will be open from February the 10th through the 21st. So make sure you go out there, click on that Start Your Enrollment button. From there, everything will pretty much be self-explanatory. As the little box here shows on the screen, you'll verify your employment information. There you'll update your email address and phone number to be entered into our sweepstakes for that prize. You'll update your family information. That's where you'll see if your dependents are eligible. If you need to remove or add anyone, that's the time to do that. Next, you'll go in and choose your benefits. You'll enroll. You'll verify that all the information that you entered is true and correct, and then from there you'll complete your enrollment. We do just want to bring your attention to the fact that you do need to enroll in your FSA benefits each year, and if you do need help with that, you can turn Emma on to assist you with that process.
Just a reminder, Janelle has already spoken a little bit about the open enrollment sweepstakes, but this is the opportunity if you'd like to enter that sweepstakes. We are just asking that you confirm your personal phone number and your email address are accurate. And I know that everybody in the room reads the fine print, but in case you missed it, you are agreeing that you've verified your personal phone number and email address before you move past that employee information screen. So if you want to be a winner, we need to be able to contact you, so keep that in mind. Eliminating
barriers to care. So it's important, we feel at iCuba, for each person covered under our plan to be an educated healthcare consumer and understand how your plan pays, what services are covered before you actually see your doctor. And so our plan is specifically designed to help remove those barriers to access to care by offering plans where the deductible only applies to those major services. So as much as you can, we do encourage you to go out to our website, go on our portal. As you're going through your enrollment, there will be some links and things for you to click on. Really take advantage of those educational materials that we've provided. We find that the people who really take the time to learn the benefits get the most out of these free and great benefits that we've already made available to you.
Just a reminder, and one of the ways that iCuba breaks down those barriers to care is through our iCuba Benefits single sign-on section. So when you log in the middle of your home screen, right under that rotating banner, there is a single sign-on to all of our brand partners. So from here, you can click into Blue Cross, Optum, Aetna. The very first time you click on that link, most of them will require that you set up a username and password. But after you've done it once, you are in for good. And every time you click on that link, you can go straight in and view your explanation of benefits or your medical summaries, or the various carriers have very robust websites available right at your fingertips.
Next, we wanted to highlight some of the great benefits you have. There's those ones that are no cost to access, of course, your Blue Distinct Total Care primary visits, colonoscopies, all of your EAP services, IQVIA Cares immunizations, just to name a few. No deductible applies for this middle section here. Your advanced imaging, chiropractic services, we just need to make sure they're in the ASH network. Your convenient care clinics, like your minute clinics, the emergency room, your physician's visits, specialists, any type of occupational physical therapy, all of those, no deductible applies to those visits. And then on the far right there, deductible only applies to your major services, some of which are listed here. And again, we just wanted to highlight how knowing what you're supposed to be paying for, knowing what the plan pays for is very important. Quite often we find that people will pay for things that are covered at no cost. So protect yourself, and we encourage you to be an informed consumer.
Moving on to Surgery Plus, we introduced this benefit last year, and it was by and large our most popular benefit for the prior plan year. So if you do elect the medical insurance, this is automatically paired with the medical plan. So not only are you getting a surgeon of quality, all the Surgery Plus surgeons are licensed, board certified, they're fellowship trained, and they've been screened for malpractice, sanctions, and criminal records. So you're getting the quality surgeon, a really top quality surgeon. There's also a financial incentive. Your deductible and co-insurance will be waived if you use a Surgery Plus surgeon for your non-emergent but medically necessary surgery. So the surgery will actually be at no cost to you. If travel is required for a surgery that you're receiving, travel benefits are also included. So if you're or if you're looking, or somebody's told you that you need medically necessary but non-emergent surgery, like a knee replacement or a hip replacement, or something like ENT-related, spine, foot, ankle, some of the items that are listed up here, we really encourage you to give Surgery Plus a call. They provide a full-service concierge approach, so they will locate your surgeon and provide you with the bios for it, allow you time to process the information and answer questions for you. Then from there, once you select a surgeon, they will schedule all appointments and coordinate medical transfer of records. And then they can schedule follow-ups for you as you wish, and they will be as involved as you'd like them to from the start. So that care coordinator, that dedicated coordinator from the concierge approach is definitely, by and large, the best part about Surgery Plus, with the exception that you don't have to pay for anything. One thing that I will note is if you do get a knee replacement with Surgery Plus, the knee replacement is going to be free. However, any physical therapy that you might need following your surgery will then fall under the Blue Cross Blue Shield benefit. So while the surgery is free, the whole entire, from start to finish, you will need to utilize your other Blue Cross Blue Shield benefits if there's follow-up care or pre-care.
Next, we also want to review Teledoc. You can talk to a doctor 24/7, 7 days a week. You can access Teledoc through our single sign-on. So you have telemedicine and video consultations anytime with a doctor. So you don't have to worry if you're on vacation or on a business trip, or you can't get off work perhaps to make it to the doctor. You can give them a call or do that video consultation. We encourage you to establish an account prior to seeking treatment. If you're sick, you really don't feel like establishing an account and answering those medical questions. So when you do go on to establish that account, we just want to make sure that your company code is IQUBA. We do have some additional information for you to review here on the screen, some of the top diagnoses in case you're wondering if there's anything that you could possibly go for or call them for. Prescriptions are, they can call in your prescriptions as well. Of course, they're not calling in for any controlled substances or psychiatric or lifestyle drugs, but if you have the flu or a sinus infection, pink eye, just consider Teladoc. It's only a $5 copay, and so that's another one of those benefits that we've made available to you.
Another way to break down a barrier to care is with the IQUBA Cares Pharmacist Advocate Program. We put this program in place a few years ago to tackle things like if you're having side effects from a new medication, or if you were denied at the pharmacy for a prior authorization and you misplaced your letter from Optum with all the details. And if you attempted a drug but you were told that you needed to try step therapy before you take a certain drug. Also, if you just simply want to learn how you can save money by switching to generics, if you're on a handful of medications and you're wondering if they're the best medications for you. These are all great reasons to call the IQUBA Cares Pharmacist Advocate Program. And they can assist you Monday through Friday from 9 to 5. They are real pharmacists and they're real advocates for you. They work between you and the insurance company and even your doctor's office. So if you do run into a wall or a barrier when you're trying to pick up your prescriptions, we really encourage you to give IQUBA Cares a call so they can advocate on your behalf to find you some real solutions.
Next, we wanted to go over the Aetna ABLE2 program. This is a condition management program. You're given 16 sessions over 8 weeks. You're talking with a coach as well as a therapist to help you identify health goals and develop an action plan. We listed some of the conditions that are eligible for the ABLE2 program here on the screen. I always say this every year that I absolutely love this program. I went through it personally myself probably a year and a half ago, and I still to this day use a lot of the tools and tips that I learned from the coach. And so if anybody has any conditions or if they have a family member with any of these conditions, we do encourage you to take advantage of this free program.
We just want to remind you that we have a team of health managers and care consultants available. So if you do receive a call from Blue Cross Blue Shield, Optum Rx, IQUBA Cares, or Aetna, they're not calling to bug you or irritate you or meddle in your personal life. They're really calling because they really care about what you're getting into with some of the chronic health conditions that are out there today. So they'll do things like assist you with goal setting, help you better understand your doctor's treatment plan, and support you with referrals or transition of care through the process. When you're sitting in your doctor's office, you're getting a lot of information, might be a little overwhelming for you. So we put these care consultants in place who consist of trained health advisors and registered nurses, just to provide you additional tools and education and help you through that process. And just keeping in mind that we are a self-funded insurance plan, this can really help keep premiums down. So if someone gives you a call, please take 5 minutes and talk to them or return their phone call, because ultimately we want you to be the best version of yourself.
And then next, we just wanted to go over some of the great benefits and resources we have through our partnership with Blue Cross and Blue Shield. The first is the Blue Distinct Total Care Providers. If you're seeing a primary care doctor, so that's your family doctor, an internist, or a pediatrician who has that Blue Distinct Total Care designation, all of your visits are at zero cost to you. And this is for medically necessary services. So as long as it's medically necessary, you go into that family practice, internal medicine, or pediatrician with that BDTC designation, your visits are always free. And then we also wanted to bring your attention to the Care Connected team there at Blue Cross and Blue Shield. They can now help you with questions on your claims. They can assist with billing. They can help you find a Blue Distinct Total Care provider. They can get you in contact with those lifestyle coaches, as well as those coaches to help you with chronic conditions. There's no new number to call or anything to remember. It's the same customer service number we've been using for years that's located on the back of your Blue Cross and Blue Shield card.
We wanted to remind everybody we rolled the My Health Toolkit mobile app out last year during open enrollment. This was a very popular addition to our benefits suite that we're offering. If you haven't already downloaded it, we really encourage you to visit your app store and download the My Health Toolkit app. If you log into the app, you can actually save your ID card right from the home screen of it. So if you're in a doctor's office and you don't have cell service, don't worry. You can pull up your ID card straight from the front without logging in. If you have an iPhone, it is available just with your fingerprint. But in the app, you can do everything that you can do from a computer with real-time data. So if you are in a doctor's office and you want to pull up your benefit summary, you can do that from the mobile app. And you can also view your EOBs. So for instance, when I go to the doctor and they tell me that I owe a certain amount, when I'm in the doctor's office, I always make sure to pull up my EOB and double check the date of service that they're making the claim for, just to make sure that Blue Cross Blue Shield also agrees that I owe that dollar amount. So it's really just a handy tool to have in your pocket.
We also wanted to review the benefits and resources that we have available through EAP program, Employee Assistance Program with Aetna. They can help you with emotional, life, legal, financial. There's, in addition to numerous other things that are out there. So for emotional, they have licensed clinicians available to help you through any of your life problems. They're available 24/7. You also get 6 free sessions through this program. You do not have to be enrolled in any other benefits through IQBA, like the medical or the dental and vision. This is available to all active employees at all of IQBA's member schools. You can get help with legal, financial, retirement, setting a will. You can start planning for your kids' taxes. They have people there to help you with legal, going through divorce, or perhaps you're being sued, or you have a tenant and you just want some legal paperwork for that. We do encourage you to go out to that website, give them a call if you're experiencing any type of life event issues. They may have some resources that are free to you available through Aetna's Resources for Living.
Along with the EAP Resources for Living that Janelle just spoke about, if you don't want to talk on the phone to somebody, they do also have a Talkspace benefit, which is the EAP digitally. So now you can text with that therapist just to get that assistance that you need. This Talkspace texting benefit is available to adults who are 18 years of older. So unfortunately, the teenagers in your household can't quite yet text a therapist. However, you have the ability to text with a therapist. You do need to call Resources for Living for authorization first. So there will be one phone call involved, but after that, you can register with the Talkspace and expect to hear back from a therapist within 1 working day during business hours.
Next, another way that we help you break down barriers is through a lot of the mobile apps that are available from our brand partners. So we just wanted to highlight some of those resources and apps that are available to you. As Rachel mentioned earlier, these apps can be a great resource when you're in the doctor's office and there's some type of billing discrepancy, if you want to pull up your benefits, if you need access to your insurance card, or perhaps you need to order a replacement or duplicate card. You can do all these things from these apps, and so we just wanted to put it here. If you can refer back to it at a later date, but I always encourage people to go out and download those apps to access your benefits on the go.
So great news, we have the same great benefits that will remain in place for these brand partners on the existing IQBA plan. So we've reviewed a lot of stuff so far. We've introduced all the new benefits. We've rehashed all the highlights that we want, and now we'll quickly review Blue Cross, Optum, Aetna, Humana, and IMED.
First up is Blue Cross and Blue Shield. So here we just wanted to review some of the in-network benefits that are offered on each of the plans here through IQBA. There's the Preferred, Premier, and the 4,000, 8,000 plan for healthy families. As Rachel mentioned, this is just a review. We have the same benefits from last year: physicians visits, specialist visits outlined here on the screen. You have that co-insurance or a copay depending on which plan you're enrolled in. But again, same benefits that we've had last year. We just wanted to provide it to you as a review during this presentation.
And a reminder that $4,000, $8,000 deductible PPO medical plan, this gives the freedom for families with children. This plan is really was designed by educators for educators to help out the people that are covering families. So this plan provides premium cost savings for healthy families with children, gives you the freedom to choose a plan that meets your needs, and gives you the flexibility to shop around for prices for service. This plan did receive a 0% increase for children and family tiers of coverage. So if you are looking for a financial break when it comes to insurance coverage and you do have children covered under the plan, this might be a good option for you. Some of the differences that we want to call out are the deductible and the out-of-pocket are significantly higher than on the preferred PPO. The co-insurance and co-pays are also higher, but the plan premiums are much less. However, if you or a family member are involved in a catastrophic event, this plan may end up costing you more in the long run because of those higher deductibles and out-of-pocket. But they're the same great core benefits that don't apply to deductible, same well-being incentives through Rally, and the same prescription drug plan.
Next is the prescription drug plan through Optum Rx. Same benefits and copay structures as we currently have. We did just want to draw your attention to some of the free benefits through Optum. Your diabetic supplies are free. Aspirin for prescribed for adults are free. Generic folic acid and generic prenatal vitamins and some generic statins, if you're available, are also free. And we also just wanted to highlight that there is a different out-of-pocket maximum under the prescription drug benefit. So in-network copays will apply to an individual maximum of $2,000 for an individual and $4,000 for family. But otherwise, as you see here on the screen, our retail, mail, copay structures have remained the same for all of our prescription tiers.
So rounding out that medical coverage, you get obviously Blue Cross Blue Shield, Optum, and then the third leg of the medical coverage is the behavioral health and substance abuse benefits. These benefits would be covered through our brand partner Aetna. So if you are seeking professional counseling where you would need to speak with a licensed clinician or need a psychiatric medication evaluation, any sort of ABA services, those are the autism spectrum services, or intensive care like hospitalization or detoxification, those will be through your Aetna partner, and that is paired with the medical plan.
Next, we wanted to highlight and just review the Humana dental plans. Again, we have those same 3 dental plans for Humana: the High, the Preventative Plus, which is the low plan, the low PPO, excuse me, and then we also have that prepaid DHMO. We just wanted to bring attention again that the DHMO is only available in Florida. So those of you who may have children that are in school out of state, you just want to keep that in mind, that they may need to schedule those dental visits when they are home on vacations. And if there are any emergencies, that child who is out of state may be left without coverage until they return to Florida. But otherwise, those dental visits, again, are remaining the same. We have a plan year maximum on High of $2,000. Your Preventative Plus has a maximum of $1,000. And then again, the DHMO is unlimited benefits. We also wanted to bring your attention to the orthodontia. Under the high plan, you have it's covered up to 50%, up to a $2,000 lifetime maximum. The preventative or the low PPO plan has no orthodontia coverage. And then on the DHMO, of course, we're going by that rate table. So up to 19 years old, there's the $800 out of pocket, and 19 plus, if you're over 19, there's the $2,000 out of pocket on those orthodontia benefits.
So iMed Vision is also remaining the same. We're still offering the base plan and the buy-up plan. The major differences between the two plans are highlighted for you in purple. The base plan is once every 24 months for frames, and the buy-up plan is once every 12 months. There is a little bit higher allowance with that buy-up plan, $130 versus $100 with the base plan. So vision benefits are still important also. So just make sure that you're electing the best plan that fits your family's needs between the base or the buy-up.
And then next, we just wanted to go over some housekeeping. We just want to remind you that changes that you make during open enrollment are irrevocable for the benefit year. That's April 1st, 2020 through March 31st, 2021. Any changes that you need to make outside of open enrollment are only permitted within 30 days of a qualified life event. Your 1095 tax forms will be made available to you in your employee file on the IQBA Benefits portal at iqbabenefits.org. Those should be available around the beginning of February. You should start seeing those coming to you in the mail. We encourage you to keep those forms in case you're audited by the IRS. We just want to let you know that all of the requirements of healthcare reform are in place here, and that all the IQBA plans are even more generous than is required by law. And then now is the time during open enrollment, as you're going through your enrollment instance, if you need to review and update your life insurance beneficiaries, we encourage you to do that at this time. And when designating a beneficiary that is under the age of 18, you also may want to contact someone or establish an estate planner who can, kind of manage that trust until the child becomes of age. So we just wanted you to keep these things in mind as you go through your enrollment this year.
We want to thank you very much for your attention. We're really excited about this 18th year of service to all of our members, and we will open it up now to any questions that you may have. I think you guys might still be on mute if anybody's asking questions.
I'm asking if we have any questions. I don't think nobody has any questions. We're all good here. Thank you very much.
Perfect.
Nothing? Last call? Any other questions? Oh, we have one.
There's so many apps. What app do you?
For which one?
Oh, no, that was where
I'm going to share the presentation that has all the apps following. Oh, yeah. Which, are you talking about Rally, the wellness? Okay, here we are. Which one? I can help you with downloading. Okay, yeah, but I'm going to share the presentation too, and then we can. Yeah. Okay. Anybody else? Any questions? Nope. Okay.
All right. Well, if you do have any questions, you can feel free to contact us at any time at IQBA. Explain My Benefits is also a great resource if you'd like to schedule an appointment with them to review your benefit offerings. The scheduling deadline is tomorrow to set up, Friday to set up an appointment with Explain My Benefits. But if there's no other questions, thank you very much for your attendance.
Thank you.
Thank you.
Have a good one.
And thank you, Emily.
Yeah, so now you know what we work on when I go to those Orlando meetings. all of these benefits, all the schools get together every month and go through and look through the plan design and those type things and have input on what that plan design is, what this presentation is, that kind of stuff. So that's what's going on. Okay, I'm going to share the presentation, and I think they're going to record the webinar for us as